Hi guys, it's Carolyn from New Beauty here, and today we're at the Long Island offices of facial plastic surgeon Dr. Marotta, and our patient Anna, and we are here today to demonstrate a liquid facelift, which if you guys don't know what a liquid facelift is, Dr. Marotta will fill you in all the details. If there's any questions that you have throughout the procedure, either for a patient or for the doctor, please leave them in the comments below, and we'll make sure to get them answered at the end of the segment. So.
Great.
Great. Awesome. So to start today, can you kind of fill in our viewers on what exactly we're doing today?
Sure. We're going to perform a liquid facelift on Anna. A liquid facelift is using a combination of either Botox or Dysport, which is a neuromodulator, something that relaxes wrinkles, or it can help potentially lift the brow, along with fillers. And fillers plump or add volume to cheeks, lips, smile lines, or wrinkles that are concerning. So we're using those two things in combination to rejuvenate the face in a way that's non-surgical and doesn't require much downtime at all.
And is it actually, do you get like a good lifting effect from this procedure?
You do. You can simulate a lift. It's not technically doesn't do what a facelift does, but it kind of can mimic that by adding some volume to the cheek area and kind of giving the illusion of a lift.
Got it. And how long does the process take?
The process itself, between the consultation process and there's some preparation work. We've done some photographs. Always important to have pre and post photographs. We go through the consent forms, which is the permission slip to do the procedure, and then we typically apply numbing anesthetic. As you see, Anna has a numbing lidocaine cream on her just to make the procedure more comfortable for her. And we leave that on for about 15 minutes or so before we do the procedure. So the procedure itself, though, is relatively quick depending on what we're doing. It could range anywhere from 5 minutes to about 15 minutes in terms of the timing.
And what about results? How long can you expect results to last?
Results you can result in terms of how long they last, or how long does it take you to see them?
Both.
Both? Okay. In terms of how long it takes you to see them, the neuromodulators, Botox or Dysport, will kick in pretty quickly. Dysport more on the orders of 2 days. We're going to be using Botox today. Usually it'll kick in over 2 to 4 days. And then the effects are maximal around 10 days. Fillers, you see those results right away. There is, however, some swelling with fillers, particularly areas that swell a little bit more are the lips. So we're going to be doing a little bit of filler in Anna's lips today. So that'll swell a little bit more, but those results you can see pretty much right away.
And then they last for a few months? Or?
Last for a few months up to a year, depending on what fillers you're using and what areas you're using them. So fillers that are done in the cheeks, for example, last somewhat longer than fillers that are done in the lips, because the lips are a more mobile structure, so your body breaks that down faster. Botox or Dysport, the neuromodulators tend to last 3 to 6 months, whereas fillers can last 6 months up to a year.
Wow, great. So who would be a good candidate for this procedure?
Good candidates are patients who want an improvement in their rejuvenated appearance and don't necessarily want major downtime. Really, everybody's a good candidate for the procedure. I do liquid facelifts on patients who are both pre and post surgery, patients who don't want surgery for whatever reason. So really, we can make vast improvements in most people's appearances, and pretty much everybody's a good candidate.
Awesome. So have you gotten this done before, or is this your first time?
Well, the Botox, yes, I have done it. The fillers, no.
Great.
It's going to be my first time. I'm excited.
Awesome. Well, we're excited to see how you do it and see what the results are like.
Sure.
Thank you.
Cool. Now, do you want to get started?
Sure. So we'll
Great.
get started.
Awesome.
Okay. All right. So I like to usually do my Botox first. So I'm going to be laying on the back. Get her a little more comfortable. And then the first thing we're going to do is just cleanse the face. I like to wipe all the numbing cream off and make sure the face is thoroughly cleansed with alcohol to kill any bacteria, to get rid of any makeup or debris, and that will help things to go much smoother. So we're going to do that first. So just wipe that stuff off. And we use a combination cream called BLT, not bacon, lettuce, and tomato, but beta-caine, lidocaine, and tetracaine. A very powerful combination, which gives a really good numbing effect. So, and patients always wonder if the numbing cream really makes a big difference in terms of the discomfort from the procedure. Really, it helps. It doesn't diminish everything, In general, though, the procedure should be very comfortable. You really should not have anybody who doesn't feels uncomfortable during the procedure. But what you do feel with Botox is a slight burning sensation. Botox is a little bit acidic, or Dysport. It's a chemical itself is a little bit acidic. So the needles we use are tiny. This is a 32 gauge needle. It's as small as you can get. I go to sometimes using I'm sorry for people who are needle phobic out there, but sometimes I actually go through the skin and the patient doesn't even realize it because that's how small the needle is. It's not actually that. It's actually a slight burning of the chemical itself while it's going. That's what you feel, more discomfort. So to cut down on that part, we like to do ice. So I'm going to do a little bit of ice right here. So Anna, you go hold that for me with your hand.
Sure. And
get that nice and cold. And then I'm going to just straighten your head out there. And the first muscle we're going to do is called the corrugator muscle. That's the muscle that causes the frown lines or the 11s between the eyebrows. Injecting this muscle is one of the depressors of the eyebrows, so it brings the eyebrows down. So if we inject that, we're going to get a little bit of a lift to the brow. You can take that off for me now. Sometimes it freezes too much. So frown for me, get real mad. So she's going to frown. There you go, and relax now. So I'm going to start injecting. Generally, it's a 5-point injection, so we're doing it. And you see a little bleb of fluid underneath there as I'm injecting. And there. And little dots there. Just grab those, Kelly, when you get a chance. You see little dots, that's just from the injection points. And then frown for me again. Now she's wrinkling up her nose. This is another muscle called the nasalis muscle. I'm going to put a couple units in there to prevent those little wrinkles that you get on the side of your nose. So I'm injecting a little bit in there. And that'll prevent the wrinkling of the nose. Okay, do some ice again. Give yourself a little break. And I like to reapply the ice. That constricts the blood vessels, so patients are less likely to get any issues with bruising. With a liquid facelift, you can get bruising. Okay, how we minimize that? Icing. Minimize the use of a needle where we can. So sometimes I'll use a blunt cannula, and you'll see me use that a little bit when I do her cheek fillers. And raise up your eyebrows for me now, like you're surprised, and relax now. And now I'm injecting. This is called the frontalis muscle. And the frontalis muscle is the one that gives you those horizontal lines that go across the forehead. In this injection, raise up your eyebrows for me again. Relax now. Relaxes the whole brow. And it's very important, especially in patients like Anna, who have smaller foreheads, is not to go too low into the forehead. Because if Botox is injected too low, then it has the opposite effect. We want to lift or elevate people's brows. We want to make them look rejuvenated, not depressed. So when Botox is injected too low along the forehead, you can see sometimes, unfortunately, a drop of the brow. But that can be easily avoided with the right injection technique. Okay, so the next area we're going to move on to is called the crow's feet. The crow's feet are those lines that people get, and the reason they call them crow's feet is usually there's 3 lines that look like a little crow's foot here by the sides of the eyes, and that's from the squinting muscle. It's called the orbicularis muscle. So we want to inject those. And typically, this is an area where you can get bruising. So if you stretch out the skin, you can kind of see those little veins which are prominent there. So that can be a problem. But we just avoid them, okay? We can see them, we avoid them. And I'm going to start doing that now and hopefully demonstrate that. And I'm just injecting in between. She's got a lot of veins there. And of course, because we're live, she's trying to trap me into giving her a bruise, but I'm not going to go for it. Okay, let's turn your head this way. Okay, put ice over here. Okay, take that off again, and then squint for me real hard, and relax down. And a little tricks with this too, you know, other than stretching the skin so you can see those veins and avoid them, is when we inject a little bit below the brow, we actually can get a little bit of lifting of the brow. Again, this is one of those muscles that pulls the brow down or depresses it. So that's how the lifting part comes in with Botox. Okay, so the next part we're going to do is a little bit of fillers for the lip. Just making sure we have 2 different products we're using here. We just used some Botox. We're going to be using some Juvederm for the lips. And Juvederm there's Juvederm, and then there's Juvederm Voluma. Voluma is a little thicker product. We're going to be using that for the cheek. And we're using the standard Juvederm Ultra for the lips. So we're going to put the chin up a little bit for me now. put a little light, shed a little light on the subject here. And we're not going to do much, right, Anna? She wants natural, right? Very important for her. She always wants to maintain a nice, soft, natural look, which she has. So for her, I'm not going to do a huge amount of volume, but I'm going to provide some strength through this portion of the lip. This is called the white roll lip. So you see that little border. And if we do that, inject right along that line, we're going to get a little lifting of the lip and a little bit better definition to the Cupid's bow. So the lip will look much nicer. For Anna doesn't really have this, but for ladies who do have lipstick lines or those that cross over into the pink part of the lip, this is what we use to correct that. But also this technique of injecting the white roll is really good for anybody who wants lip definition. It really makes a huge, huge difference. So you'll see that right away, injecting a little bit of filler across that white roll, and you see that sometimes women will use a lip liner, so this is kind of like lip liner that you don't have to work on your own. And you see, just from injecting that half of the lip, you can see the nice elevation and lifting of that portion of the lip with respect to that side. So here she has a little flatness, and you see the plumping of the lines there too, a little bit better definition. So that's really our goal for today for her. Okay, take a little break now and do some ice there.
Okay.
How you doing? You doing okay?
Yeah, perfect.
This is the most sensitive part for people. Lips are typically a little bit more sensitive than other areas that we inject.
Not too bad.
But she's
no.
doing well. And we left the numbing cream on for a good long period of time. For patients who are really afraid of discomfort, there's things we can do, local anesthetic blocks, for example, to numb the nerves that give that sensation to the lips. But I find for most patients not necessary. And the problem with doing those is sometimes they also will give you some bruising or give you numb lips for 2 or 3 hours afterwards, and then people bite their lip, and sometimes it's more to go through that local anesthetic block than it is, and adds to recovery than it is to just do it with numbing cream and a little bit of courage and ice, right? Thank you for finishing my sentence. I don't know what I was going to say next. Courage is perfect, though. That's a perfect word. Okay, so we have alcohol white.
No, I think really didn't hurt.
Okay, now we're just going to wipe there. And now that I've done the top of hers, I want to do also a little bit on her bottom. We always want to make the bottom lip, keep the bottom lip slightly bigger than the upper to maintain that natural proportion. And lips can always look beautiful and soft and natural if you make sure that that bottom lip's a little bit bigger, not too much fillers injected in the corners of the lip or on the sides. That's when people get that trout pout or that kind of funny look when there's so much volume on the sides of the lip. And that's what, and I tell patients this all the time, lips can look beautiful and soft and natural in no matter how much volume you put in, but you have to do it anatomically the right way to give that soft look. And it doesn't matter, again, you can go for just a very subtle augmentation like we're doing here, or do quite a few syringes and still look really soft and natural. There's a lot of you have to have a lot of respect just for the anatomy and what the ideal lip looks like. So when you look at her now, she had nice lips to begin with, but now her bottom lips are about 1/3 bigger than her upper. We have a nice definition to the Cupid's bow. We don't have any more lipstick lines, and the lips just look good. But even now, 30 seconds after they're done being injected, they swell. So they're a little bit more swollen than they're going to be. Okay, let me sit you up now. Okay, so now that portion is done, we're going to be starting to move on to the next area, which is the smile lines. Smile lines, the technical name for them is called the nasolabial. We'll just shut that. Called the nasolabial folds, because they go from the corner of the nose to the lip, so nasolabial. And then we have another fold down here. This is called the labiomandibular fold. Goes from the lip to the corner of the mouth. Now she doesn't really have deep ones. She has a little secondary wrinkle here, but doesn't really have some folds here. But we're going to get a nice correction with a few syringes. So a little bit of ice in this spot now. And I use a lot of blunt cannulas for certain areas. I like blunt cannulas for the tear troughs, which is underneath the eyes. I inject those a lot. She doesn't really have deep tear troughs. She just doesn't need that. I like to use blunt cannulas for cheeks. Certain areas, though, I prefer to use needles where we can layer products sometimes. I know a lot of docs will use blunt cannulas for nasolabial folds even, but I find I can go underneath the skin and in the layers of the skin and get better correction with a needle. So let me take it off for a minute. So I'm just going to correct this little secondary line over here. And you see while I'm injecting, you see a little bit of swelling or bumpiness. Patients don't usually see that, but you guys are seeing that. That massage is important right afterwards. So open your mouth for a minute. Right after I do it, I massage the product, and then I tell patients they don't really have to do it. I usually do all the work for them. When they go home, it's all done. Okay, so now we're on to our second syringe at 2 gr because we used a little bit in the lips. That was just a tiny bit for the smile lines. Again, hers aren't really deep, so deeper smile lines might require more fillers. And this isn't just injecting that product there. Okay, again, you can open your mouth for me now. Now, this may, look easy, and you might go home and say, you know what, I'm going to do this on my own. Order some stuff from China. But not a good idea. A lot of complications or problems are potential with, going to put some ice on this side, or, the Botox and fillers have a potential for. So we won't go into all those scary things now, but you have to just be very careful. There are lots of blood vessels and issues that can happen with fillers. So you really need a very qualified medical professional who's a specialist and one of the core specialties to be doing your injections. And open your mouth for me now. Great. Okay, and ice up and a little higher now. Put the ice over there. And I change the needles in between when I'm doing injections. The needles get a little bit dull, and it sounds weird, but the sharper the needle is, the more comfortable it is for the patient. Okay, great. And open your mouth again for me. Good. Okay, just wipe with alcohol. All right, and we're doing that constantly, wiping with alcohol wipes just to make the patient keep the patient clean. Also to again disinfect the area right before we do the procedure. And I changed my gloves because I just touched inside her mouth, so I don't want to, get any bacteria on the new fillers that I'm going to put in her cheeks. Infections can happen with fillers, and there's a newer thing that we become aware of as physicians called biofilm. Sometimes fillers, if they become infected, can give this kind of strange swelling a couple weeks after the procedure. So again, it's important to go to a qualified medical professional who's going to recognize that and be able to treat you if you were to develop one of those kinds of complications or problems. But it's very avoidable using the right technique. Okay, so we're going to start on the cheek fillers, and here I'm going to use a blunt cannula. And what you notice about cheeks is they tend to deflate a little bit with time. So Anna's got some volume loss through this lateral portion of her cheek. This we call the malar septum, which kind of deepens as time goes by, and it looks like the cheek is falling a little bit. Again, not too bad. She's beautiful and really doesn't need my help at all, but we're going to make her even a little bit better, right? Okay. So that's just the little needle mark there. And the blunt cannula means it's not sharp at the end, it's dull. And so the advantage of that is that the little blood vessels and things like that that could cause bruising move out of the way when we're using the blunt cannula. So it's also more comfortable for the patient. They might feel a little pressure underneath the skin, but it's really generally not something that, something that bothers people at all. Well, there's a little needle mark there, and now I'm injecting the fillers, and using this kind of fan pattern, I'm just augmenting that area we call the malar septum for Anna. She feels a little pressure. The good thing about this, in particular, voluma, etc., and Juvederm, is they have a little bit of lidocaine in them, so as we're doing those fillers or injectables, it's numbing the area too. And now I'm augmenting the area of her cheekbone, also lateral cheek as well at the same time. How you doing, Anna? Okay?
Good, good, perfect, doctor. Thank you.
Okay, and that whole cheek is done already. So you see that kind of lifting effect, the more shadowing or definition of the cheekbone here. And then I always will massage a little bit too, just to soften things up. Excellent. Okay, let's move on to the other side. Face the other side.
Sure.
Okay, that's good. And patients are always worried. They always look at their cheeks and they say, well, this cheek is a little different than the other one. And you have to realize your cheeks most of the time are different from one side to the other to begin with. We all have one cheekbone, so slightly bigger, and the jawline, the bony structure could be a little bit longer. The eyes can be different shape and size. And symmetry doesn't equate with beauty. Okay, so we don't need perfect symmetry to be beautiful. We just need, a reasonable approximation of that. So sometimes we'll put a little bit more volume on one side than the other to correct radical asymmetries. But for the most part, for most people, we kind of want to augment equally on each side. And same thing, her most important area is this, what we call the malar septum. And I do a lot of fat transfer. So fat injections are done pretty much the same way I'm doing it here with a blunt cannula, using your body's own fat. And the advantage of that is it lasts a little bit longer, lasts about 5 to 7 years. But the process is pretty similar. Because after all, the face is made up of mostly different facial fat pads, and so volume loss or aging happens in the face, loss of facial fat happens, and that's what we're doing either with fillers or with fat transfers, replenishing lost volume to give patients a more youthful look. And most of the time when you look at people, in the news or in Hollywood or things like that, and then you see them, you see them get a concussion by bumping there, and they disappear for a little while. They come back and they look a little refreshed. They look just, what we're going for. It's basically a result that the patient looks refreshed, they look beautiful and natural, but no one really knows why. And you really can't put your finger on why that is. And the results are nice and subtle. So you see again, you see highlighting that the cheekbone now, she has a much higher ridge. It's like what women might naturally try to accomplish with makeup. They don't have to do it anymore because we've got lip liner, we've got arch to the cheekbone, and more definition to that cheekbone. So that's it. We pretty much have completed the liquid facelift part. And just give an alcohol count. How you doing? Okay?
Perfect.
Okay, so she's all done. I mean, she's ready for, in 20 minutes, those little marks you'll see will go away. With, any of the little slight swelling that you see in the forehead from the Botox injections, that'll go down again in about 20 minutes. She'll be able to put makeup on. She'll be able to go back into normal life. I usually tell patients don't exercise for 24 hours. You know, just don't want things circulating around too much. But pretty much quick procedure, quick recovery, no recovery really, back into normal life.
Very comfortable.
Numbness, if you have any, you know, maybe, you know, slight numbness because there's a little bit light in this stuff. So for maybe another hour or so.
Awesome.
Okay.
Great. So we have some questions
Sure.
from our viewers. So first of all, you were so comfortable during that whole thing. Did it hurt at all?
Yes, no.
That's
You
awesome.
can feel
Yeah.
a little, a little bit, but almost nothing.
That's
you know?
great. Yeah, it looks great.
Yeah, thank you.
So, some questions from our viewers. What would the price of this procedure be?
Price of the procedure be, Cal, what would it be? I usually don't do that kind of stuff. I don't talk about that.
It would be anywhere from about $2,700 to about $3,000.
Okay, got it. And then they wanted to know, how do you choose what type of filler to use?
Sure. It depends on the area that we're injecting, by area, by patient preference, by patient comfort, and by the kind of problem we're trying to treat. So, for example, I find that for mid-facial augmentation, Voluma is a good product. It's a little softer. It's good for people who don't need as much definition to the cheeks. Whereas if I want somebody with has a lot of volume loss, or I need more rigid definition, I might choose a stiffer product, like Radiesse, for example. And so that's kind of, I guide the patient with regard to what products are really the ideal treatment for them.
Got it. And then, can you also do this on the neck as well?
Sure, you can treat the necklines, those horizontal lines that go across, you can treat those. It really depends on what the problem in the neck is. You know, if somebody's got a lot of loose skin or muscle loose problems, then the liquid facelift is not for the neck, or liquid neck lift is not for the neck. If they have horizontal lines that go across, yes, those can be treated really well with fillers. Sometimes the banding in the neck can be treated with Botox. That works extremely well. So it really depends on what the problem is, and that you might need an evaluation by a physician to determine that.
And, I mean, obviously today you just did everything in one go. Are there any situations where you might advise somebody to come back and do it in, like, different segments? Or can you just, inject the whole face?
It's patient comfort. You know, I mean, so I have some patients who they come in and they do the whole thing at once. I have some patients who are very nervous, so they start slow. They might start with one area and then come back and do it sequentially. So they might start with their smile lines, and then they graduate and then onto those other areas, and then some patients just do it all at once.
And what is the maintenance like? If different injectables have different, they last a different amount of time in your face, would you come in after a few months and kind of get touch-ups?
Yeah, usually I also see patients first for the neuromodulators. So I typically will do a follow-up visit about 4 months. If you have a patient who you see in that 4-month period and they're really still good, I mean, they've got all the wrinkles are gone, they still have that lifting and filling effect, then we don't do anything. We just see them again. Okay, we'll see you in another 4 months. And then we kind of do it that way. With fillers, I like patients to come back before they've worn off completely, because re-injection sometimes will make the fillers last much longer than they initially would have. So,
Are there any side effects outside of bruising?
there can be side effects. They're more complications than side effects. So, for example, allergic reactions are possible. You could have an allergic reaction to either a preservative in Botox or Dysport, or to the fillers that we use. You can have what we talked about before, infection, sometimes what's called biofilm, an indolent infection. You can have occlusion of blood vessels, which is a medical emergency. If you were to have that happen, it should be recognized right away and be treated right away. So we have a whole protocol. If in the event that were to happen, we have a protocol to treat patients safely for that problem. But those complications and risks they're relatively rare. I mean, it's very rare for patients to have any of those problems.
Can you feel the temples?
You can feel the temples. Yeah, temples need to be done in a very deep place. They need to be definitely done by an experienced injector. Lots of blood vessels there, so you have to be careful with that, but they're a very good place for doing injections.
Got it. And the last question is, at what age do you start recommending that people look into injectables and fillers?
It's really, I don't think there's any one set age. I mean, of course, people in their teens are a little too young for that. But that being said, there's always this media hubbub about people in their 20s doing Botox. I've seen people in the 20s with these very deep etched forehead lines and crow's feet who, get tremendous benefit from starting Botox, doing Botox a little earlier. So I don't turn those patients away just because they're 20, it's just a number. And conversely, people on the other spectrum that are in their 80s who, don't want to necessarily, they just want to do Botox and fillers, they can, again, benefit from it. So there's really no strict age restrictions.
Awesome.
Yeah.
Great. Well, you look fantastic. This was so
Thank
much
you.
fun. We had definitely a lot of interest from our readers today. So thank you so much again for
Thank you for
letting us
having
come into your office and kind of see what you do.
me. Great, thank
All
you so
right.
much.
If you guys have any more questions, please do put them in the comments below and we'll go in and answer them. Thanks, guys.